looking at our major tray set. Usually when we use a major trays for major procedures, somebody having something like a bowel obstruction, surgeon have to go in and make a big incision in the abdominal area to go in to fix the issue that the patient is having. Retractor, again, it's for manual retraction. These are your wheat liner. These are self-retaining, so nobody has to hold it. Surgeon put it in, and they hold it right there. These are different types of suctions. This is your pool suction. It is used again in those abdominal procedures. It's easy to evacuate fluid out of the abdomen without getting stuck. This is your Fraser, mostly used in ENT procedure. It's small, you can get in small areas. Comes with a stylus. If it gets clogged, you can use it to clean the area. These right here are your pickups. This is your Ferris. It usually comes in the major tray. You will not find this in the minor tray. Right, big and strong. That's what they use to grab the fascia when they are closing.